Can you charge a Medicare beneficiary a no-show fee or a cancel fee for not attending a physical therapy appointment? Absolutely you can, and what I'm going to do in this video is read from 2 Medicare resources. I'll share those resources down below to give you the original source reference for creating your no-show or cancellation policy that allows you to charge both Medicare beneficiaries and non-Medicare beneficiaries alike if they book an appointment and they don't arrive for that appointment. So the first and probably the most important resource is going to be the Medicare Benefit Policy Manual, Chapter 1, General Billing Requirements. And this is transmittals for Chapter 1. You're going to scroll down to section 30.3.13, charges for missed appointments. And so just to read a couple of the guidelines here so that you have it from the official reference, basically it says CMS policy is to allow physicians and suppliers to charge Medicare beneficiaries for missed appointments, provided that they do not discriminate against Medicare beneficiaries, but also charge non-Medicare patients for missed appointments. The charge for missed appointments is not a charge for the service itself, to which the assignment and the limiting charge provisions would apply, but rather the charge for a missed business opportunity. Therefore, the physician or supplier missed appointment policy applies equally across all patients, Medicare and non-Medicare alike. Then the Medicare law and regulations do not preclude the physician or supplier from charging the Medicare patient directly. And then it goes on to say briefly, the amount that the physician or supplier charges for the missed appointment must apply equally to all patients. So Medicare doesn't dictate. You could charge the full rate, you could charge a portion of the rate, you could charge whatever you determine is appropriate, but you have to charge all patients alike, both Medicare and non-Medicare. They also do not state for what kind of time frame you need notification. So I know a lot of providers will do a 24-hour cancellation policy. If the patient cancels with less than 24-hour notice, they'll apply the cancellation fee. But Medicare doesn't really designate what is the time frame, whether it's 60 minutes, whether it's 24 hours, or even longer. So what I encourage you to do is go to the Medicare guidelines. The links are in the description below. Read through the policy. Another resource that I like, now this one is from 2007, but it is MLM Matters, number MM5613. It's the revised version. And what this has that's nice is it's got a couple key points that it pulls out. So for example, it says the provider may bill the Medicare beneficiary directly. Medicare does not make payments for missed appointments, fees, charges that are imposed by provider, physicians, or other suppliers. It says claims for missed appointments sent to Medicare will be denied with reason codes 204, which is, quote, the service, equipment, drug is not covered under the patient's current benefit plan. And so knowing that this is not for covered services, that kind of opens the door and says you do not need an advanced beneficiary notice in place. You do not have any limits on what you charge as long as you charge the same for Medicare and non-Medicare missed appointments. And then it says briefly, in most instances, a hospital outpatient department can charge a beneficiary a missed appointment charge. In the event, however, that a hospital inpatient misses an appointment in a hospital outpatient department, it would violate CFR 489.22 for the outpatient department to charge the beneficiary a missed appointment fee. Anyone watching this, your Medicare Part B providers, that does not apply to us. Physical therapists in private practice, occupational therapists in private practice, and speech language pathologists. So this is the resource. Yes, you can charge a Medicare beneficiary a cancellation no-show fee. It just has to be an established policy and it has to be applied universally across all of your patients. Guys, if you have any other questions like this, absolutely post them in the comments and I'll do my best to research the answer for you.